Thank you very much for virtually joining us as we review the latest situation update regarding COVID-19. I'm very pleased to be joined today by Dr. Kate O'Reilly and James Bird, and together they'll go through the notable changes over the pandemic in the past week and introduce our brand new COVID-19 impact scales. But before going into that, I'd like to pass it over to Dr. Kate to take us through the notable changes over the past 2 weeks.
Thanks, Kayla. Hi, everybody. So as of today, 27th July, we've seen over 16 million cases worldwide. This is up by 1 million in just 4 days and over 640,000 deaths. The United States has reported the highest number of cases, over 4 million now, and that accounts for over 25% of the world's cases. This is followed by Brazil, India, and Russia, and Latin America remains the epicenter of the outbreak, with Brazil the worst hit, followed by Mexico, Peru, and Chile. But we've also seen in Argentina and Colombia acceleration of cases. Elsewhere in the world, Hong Kong has reported a new daily record of 145 new cases. And we've also seen clusters in China and Australia and Vietnam have reported their first locally transmitted cases since April. We've seen a number of cases reporting a second rise in cases, and these include Spain, Israel, Australia, and Japan. And over the weekend, we saw that the UK announced a ban on all but essential travel to Spain, and visitors returning to the UK from Spain will now have to quarantine for 14 days. And this is one of the reasons why companies need to be really flexible and aware that situations can change quickly, and they need to be reactive and prepared for unexpected lockdowns and quarantine measures being implemented as situations in different countries change. Obviously, the numbers that I spoke about are just a guide. Numbers worldwide are likely to be much higher, as people with milder symptoms have probably not been tested and therefore not counted. I thought I might also just talk briefly about where we are in the world with the vaccines. At the moment, it feels like there's a little bit of a vaccine race going on, and about 80 teams of scientists around the world are working hard to research possible vaccines to prevent the virus. And at the moment, the WHO lists 25 candidate vaccines, which are currently in clinical evaluation. So out of those, there's 3 frontrunners, Sinovac, Oxford University with AstraZeneca, and the Moderna vaccines. And they're all starting what we call phase 3 trials, which are looking at, can the vaccines actually prevent infection? So they've already been through the trials to see if they're safe and what doses should be used. And they've also looked to see if they generate an immune response. So this is now looking at, can they prevent the actual infection? So for lots of these vaccines, as well as being tested in the country that they were initially made in, they're being expanded to other countries. So the Oxford AstraZeneca vaccine is being tested in the United Kingdom, Brazil, and South Africa. And hopefully there'll be more data in the coming weeks about these vaccines. Thanks.
Thanks very much, Dr. Kate. Now, James, if I can pass it back to you to talk us a little bit through about these new COVID impact scales and how it's being supporting our clients now and in future.
Thanks, Kayla. So as the pandemic has evolved, we've been supporting our clients in how best to ensure their business sustainability and effective risk management. And this relies on 3 critical considerations: health, security, and logistical. Knowing this, we quickly understood that there was an opportunity to provide an enhanced integrated layer to supplement our existing long-standing medical and security risk ratings and their associated methodologies, the COVID impact scales. These new COVID-19 impact scales provide business critical indicators for organizations seeking to reduce the impact of COVID-19 on their operations and to ensure the safety of their entire workforce.
Thanks, James. So you mentioned health risks. Dr. Kate, can I pass this over to you to tell us a little bit from your perspective how the scale will impact organizations and how it differs from other information channels that already exist?
Yeah, sure. So medically, we currently have a number of different channels. We've got the location with cases page on our pandemic site, and on there we have the COVID-19 cycle, which it categorizes countries into limited activity, increasing activity, outbreak, and decreasing activity. And we've spoken about these previously in our situation updates. We also have our interactive data visualization pages, which looks at data by location. Now, the new COVID-19 impact scales track current impact of the disease on the ability to conduct international travel and or separately domestic operations, as we know that these two areas pose different risks and require granular evaluation. So as we've seen with Spain, case numbers were rising, and they have been for a few weeks. And this is one of the variables that we look at in the domestic scale. And this then reflects in the overall score. And clients can then use this to make informed decisions based on the comprehensive medical, logistical, and security data that the scale brings together.
Thank you, Dr. Kate. James, back to you from a security perspective, being one of the variables in these scales. How do you perceive the new methodology impacting clients and how we can support them?
Thanks, Kayla. So the impact scales will support in multiple areas. At the base level, they will sit hand in glove with our country level reporting and give the reader a rapid assessment of the extent of the impact of COVID-19 on a given location to help inform their situational awareness and ongoing planning and analysis. For example, if a client had planned travel for multiple locations across their global business, then they could use the travel scale for a quick sanity check as to where may be impacted most severely by the pandemic, including locations to which inbound travel is simply not feasible. At the next level, they can be integrated as part of a consulting solution, looking at both the return to travel and the return to operations agendas. In the case of the return to operations, the domestic scale and its constituent components, which cover medical, security, and logistical parameters, could be used as a decision-making support tool for managers to gauge their current organizational posture.
Thank you very much, James. And thank you to both for joining us today and giving us a preview of the new COVID-19 impact scales. To learn more about how we can support your organizations in a safe return to operations or travel, please do get in touch. And always, as the situation continues to evolve, please review our up-to-date information, advice, and assistance regarding COVID-19.